Yes, family and friends and everyone who is in the house, welcome to the platform. Welcome to this platform, Benjamin the Wise Guy. I am Dr. Ben myself, and we talk about health issues on the platform, health matters. Talk about health matters, yeah. And we have been talking about issues concerning pregnancies, and I think it's a nice time that we do one to three things, and at least to get out of problems and we come to the normal way. So if you are coming in and you are new to this platform, it's a good time that you do what you subscribe to the channel, and follow the channel closely, and be part of the community, of my community. If you have any question that is medical, always ask. We have so many people in this channel that follow, and we relate and talk in a good way, and that is the purpose of a community. Welcome everyone. Tell me where you are watching from. If you are watching from Asia, America, Africa, everyone, come to the chat and tell us where you're watching from. Sibel Fidanela. Hi Sibel Fidanela. Hi, which country are you from? I'm just welcoming people before I start the topic. Bro, say Yusuf. Oh, okay. Your name is Yusuf. Okay, nice one. If your name is Yusuf, welcome to this channel. If it is your first time to this channel, please subscribe to the channel. Here we talk about medical issues, mental health issues. We talk about several things that are important. We talk about issues that relate to health. So, Sibel, which country are you from? Just a minute, my guys. I'm from Kenya. I'm from Kenya, and Kenya is motherland. Kenya is motherland, and I'm from Turkey. So everyone, Jamaican uncle is here. Welcome, Jamaican uncle. Welcome everyone. Welcome everyone who is watching. Welcome everyone who is in the platform. I thank you for visiting. This is Dr. Benjamin. We talk about medical issues here. We talk about medical issues. And don't forget to like. When you go to a platform that does good things, you like so that it welcomes so many people. It gives impression. So you there that you are watching, big up every time. Big up everyone that is here. Big up everyone that is watching me. I can see we have a new friend which is called Yusuf Sibel from Turkey. She's Turkish. I'm from Kenya. I'm Dr. Ben from Kenya. Sibel, I'm Dr. Ben from Kenya. Kenya is my motherland. So for you, where you are chilling from, where you are relaxing from, you are invited to this channel. Just wait a minute. Don't go away. Let me change the settings. I think these settings are hanging. Let me change the settings. As we continue talking, let's continue, my friends, and sorry for the confusion. I'm trying to handle some things while I'm live, so it's okay. Let's continue to learn. It's Joya. Hi everyone. It's Joya. How are you doing? It's Joya. Hope you are doing good in Qatar. I'm just welcoming people. Dr. Ben, greetings. It's Joya. Today, at least I had a good morning off. And as usual, If I get an off morning hours, I usually have my little good friend. So we went out and had some breakfast, and I came to work. And but today is just arrived at work. Nice one is Chwea. Hustle hard is always good. Now today, at least I had an easy time, but I came. Thanks, is Chwea. Like done. Chwea says my like has been done. Good one is Chwea. So today we are going to talk about how to take care of pregnancy from the day a woman gets pregnant to the day of delivery. You get? So good news is Uncle is here, always supporting us. It's Chwea is here. If you want to see Qatar, follow It's Chwea. If you want to see Jamaica and the US, follow Jamaican Uncle as he comes from all these continents, visiting and giving us content. But you know, when you come to Benjamin the Wise Guy, here we talk matters health, we talk matters mental health, matters good health, how to live well with your life, how to live well with your everything working properly. So you guys who are here, thank you so much for stepping in. If you have any question as we continue to the talk, if you have any question, pose it to the chat. And if you are a new guy to this channel, my friend, what are you waiting from? Come to the channel, tell us where you're watching from. Tell us where you are watching Benjamin the Wise Guy from. So the topic of today as we start the journey is healthy pregnancy checks for conception to delivery. Healthy pregnancy care, it is called antenatal clinic, involves regular assessments from conception until delivery to ensure that health of both the mother and the baby are okay. You see, both, not the mother alone, the mother and the baby, to ensure that the mother and the baby are okay. We have not said to ensure the mother is okay, because now life is with two people. So the general assessment, general life proceedings, how you take care of yourself from the day you get you are pregnant, from the day that your woman tells you that I missed my period. You know what? Surprise! I missed my periods. You understand? We want to check out and see from that day, how can you take care of this lady? How can the lady take care of herself? The World Health Organization is the major recommendation group recommends at least 8 contacts to the clinic for uncomplicated pregnancies to reduce maternal and newborn complications. When you are pregnant, at least 8 visits to the hospital before you give birth. But if there is any complication, we cannot say 8. You have to go as per the doctor's advice. Now, before, you know, there is that thing that we say before you get pregnant. Before you are searching for a baby, so before you get pregnant, what are things that you should do before pregnancy? What are the things that you need to do before pregnancy? They are called preconception care. Preconception care. You know, conception is where you get a baby, So preconception, you history, previous pregnancies and outcomes. Have you ever been pregnant? How did the outcomes come? Was the baby okay? Was there any problem? The other is preconception care. It is called preconception care. Do you have any chronic illnesses like diabetes, hypertension, and epilepsy? Do you know why I'm talking about chronic illnesses? It is because one thing, chronic illnesses like diabetes, if you have diabetes and if you are not taken care of, you give birth to babies that are called microsomic babies, big babies with big heads, macrosomic babies. And this is why it is very important. To have a preconception care. Chronic illnesses, hypertension, and you saw hypertension can make a baby be born with neural tube complications. You see, epilepsy. These are things you should put in consideration first and talk to your doctor. That I want to get a baby. What do you advise? Previous cesarean section. if you had a previous cesarean section, are you ready to go again under normal delivery? Are you carrying the baby normal? There is several things that you need to consider if you have undergone a cesarean section. Family history of genetic diseases like the sickle cell diseases, family history of genetic diseases like neural tube developmental problems. Those are like autism, ADHD, those things. And then there is lifestyle. Your lifestyle. We are talking about preconception, we are talking about preconception, and preconception is before. So how is your lifestyle? How is your lifestyle? You like smoking and you want to get a baby, you like alcohol and you want to get a baby, you use other drugs and you want to get a baby. These are factors that can make your health and the baby's health to be at stake. So as you plan to get a baby, we have said we are going to discuss step by step pregnancy health from conception to delivery. And when it is from conception to delivery, we have to talk about before conception. And there are some things that we look at, several things that we look at that they are very important. Physical examination, your height, your weight, your body mass index, blood pressure, because if you are hypertension, there is important care. Your sugar levels, if you are diabetic, we have to start taking care as a diabetic mother who is planning to get a baby. General health assessment is very important. And then there are some things that you should do. This is preconception. You are planning to get a baby, that discussion with your man, you are talking, you are evaluating everything, you are coming here and there, talking about this and that, you get it. These are very important issues that people should mind and there are some laboratory tests that you should check out, some good laboratory tests that people should be checked out. And which are these laboratory tests that people should check out? 1, blood group and rhesus factor. There is this thing that is called, why do we talk about blood group and rhesus factor? When you want to get a baby, there is something that is called rhesus isoimmunization. If you don't care, you may give birth to a baby, a still baby. Why? Is a condition in which this one, rhesus immunization, is a condition in which a rhesus negative mother develops anti-D against rhesus positive red blood cells. You see, these antibodies cross the placenta in future pregnancy and destroy fetal red blood cells. So if you are planning to do it, how does immunization occur? We will talk about it. If you are a mother and your blood group has rhesus negative and the father has rhesus positive, you get, the fetus may inherit the rhesus positive blood from the father, and that one becomes a problem. Interaction becomes a problem. We will talk about it. It may end up miscarriages, ectopic pregnancies, placenta problems, So when you are discussing when to get a baby with your man, you are discussing how to get your baby with your woman, these are things that you should consider: a rhesus positive mother and a rhesus negative mother. You see, you should check it out so that when you are having it after conception, you get anti-D. We don't want to give birth to still babies. We don't want miscarriages. You get? These are things you should consider. That one, rhesus isoimmunization, we will discuss it in depth. It's a very important topic in the life of human beings, because many people get miscarriages at the villages not knowing what is happening. And it's only the rhesus isoimmunization. The mother is rhesus positive, the father is rhesus negative, and the baby inherits rhesus negative from the father, and then the interaction starts. You see, HIV screening for important tool for care of the mother, that is very important. Hepatitis B screening, the effects of hepatitis B, these are very important. We should take care of these mothers and we should take care of these children in a very important way. Rubella immunity, blood sugars. I've said, if you don't take care of yourself when you are pregnant with high blood sugar, you will get a baby that is called macrosomic. And that one is a big problem. Check urinalysis. When I say urinalysis, what do I mean when I say check urinalysis? Proteins in urine, complications of hypertensive disease, and organ damage, preeclampsia. These are things we should consider when we are planning to get a baby. Now, you go there and now you have talked to your man. You should think about counseling, what to get, what to do, what not to do, and what to consider. Now, there is counseling, and counseling entails drugs you should take, healthy diet, exercise, avoid smoking and alcohol. Very important. Avoid smoking and alcohol, my friend. Weight optimization, vaccination if needed. Vaccination, rhesus sensitization, rhesus immunization. That one I've talked about. Folic acid is important because when the cells after conception are growing and they have been implanted, the work of the folic acid is to take care of the cells to grow well so that the baby can come out in a good way. This one entails in the counseling space, in the counseling area. The nurses take care of the counseling so well and they take you through step by step. So this I have, okay, my friend, just a minute. Yes, guys, I've told I'm working while some guys are doing this and that. So that one, those are components of something that is called preconception. Preconception, ideal pregnancy, care begins on conception. So history, physical examination, laboratory tests, and counseling of the drugs that you should take, and they are very important. These are drugs that are very important. Folic acid, iron, because the day of getting birth, you may start bleeding. And when you start bleeding, you need iron to take care of your hemoglobin. Folic acid to take care of the multiplication of cells and the baby growth. Now let's talk about the first trimester. But remember, preconception is important, and preconception, you have talked about history of the person, man, physical examination, laboratory tests, counseling, and other issues like lifestyle. Vaccination, we have talked about it. It's very important. So my people, let's talk about the first trimester. The first trimester is important. The first trimester is very important. First trimester, let me check this out. The first trimester, the first trimester is very important. You see, the first trimester is very important because it is when the cells of the body cells are multiplying and forming the baby. If anything happens to these cells, you will not get a normal baby. You see, so first antenatal visit, ideal before 12 weeks. Confirm pregnancy first. 0 to 13 weeks. First trimester, 0 to 13 weeks. That is 12 months, right? Because a month has four weeks. So 0 to 13 weeks, that is the first trimester. Confirmation of pregnancy. And confirmation of pregnancy entails very important issues, and these important issues are: 1, check on, confirm if the HCG strip is positive, and do an ultrasound to confirm there is pregnancy. No snowball in the ultrasound. We say this person has a pregnancy. You see, you have lost your menses. Very important. Last menstrual period is important. Estimated date of delivery is important. And do you have the symptoms of pregnancy? Do you have the symptoms of pregnancy? Do you have nausea, vomiting, bleeding, or pain? See, these are things you should consider, because sometimes, you see, when we are talking about molar pregnancy, we saw people have feel vomiting and nausea, and they bleed. But when you check on the when you check on the strip, it is positive. Check on these things; they are very important. Now we are talking about the first trimester. And then, if you are a first mother, counseling is important. If you have previous pregnancies, history, how were they? How was the outcome? And then there is another very important topic: medical history. Medical history of the person who is pregnant. How is the medical history of the person who is pregnant? Do you have any hypertensive disorder? Do you have any hypertensive disorder? Do you have any problem entailing diabetes? Do you have in your family history of genetic problems like autism, like some syndromes like Klinefelter's, Down syndrome? Do you have problems? Family history. How is the outcome? This is the first visit to the hospital. Now we go to physical examination, which is important: height, weight, BMI, your blood pressure. Is it normal? Pulse rate. How is your pulse rate? How is your temperature? How is your temperature? Is your temperature okay? Is your temperature okay? Then after we have done the general checkups like blood pressure, pulse, and temperature, the next one we go is systemic: heart, lungs, the thyroid. How is your thyroid? How is your thyroid doing? Because in pregnancy and the thyroid, thyroid can do that. You have high blood pressure if it has an imbalance. Check on the breast examination. Do you have nodes on your breast? This is the first visit, and it is systemic. Now we have moved from the general. Now you are pregnant, and we want our pregnancy to be okay. Very important things that we should follow step by step. We have come from general: BP, blood pressure, pulse rate, temperature. We are going systemic. Then the nurse will examine the pelvic examination. Is your cervix closed? How is your uterus size? Do you have any masses around your abdomen? Any masses, And if there is any masses, are you bleeding? Do you have things like myomas? Myomas are like fibroids, fibroids. Do you have any infections? That's why when you go to the hospital, there are those tests that are done. Even if you don't have any infection, you have to certify that you don't have any infection. Now, certification of the laboratory tests. The important part here is blood group. Blood group is important. Maybe the day of delivery, you may need blood. Rhesus factor. And why rhesus factor? Because a woman who is having is a rhesus positive and is having a baby who is rhesus negative may need an injection of rhesus isoimmunization, so that the mother's blood cells cannot destroy the baby. Hemoglobin levels is very important. You need oxygen. Full blood count. Full blood count means full hemogram. HIV screening is always important. Syphilis, VDRL, RPR. Because syphilis can cross the placenta, go to the brain, and then the baby or even the mother can turn out to be not okay. You have had syphilis has made people go mad. Blood sugar levels to confirm that you are not diabetic. Urinalysis to confirm that you don't have hypertension and you don't have proteins in urine. Do urine culture. Urine culture is very important. But there are some things that are optional. All hospitals do them, some hospitals don't do them. The rubella antibodies, hepatitis C, tuberculosis screening. Some hospitals do them, but some hospitals don't do them. See, so it is important to do these things. It's important to do these things, and you don't just say that you are okay. You will go to the clinic when the month is. You cannot say that, because the health of the baby plus you yourself is very important. The health of the baby and you yourself is very important. Ultrasound. When it comes to when you are going to the second trimester, the 13th week, when you are going to the 13th week, this is where now you check, because week 11 to 12, that's now we are upgrading to the 12th. Some organs have started forming, and the baby now is coming out. This one is to confirm viability of pregnancy. To confirm the viability of pregnancy. Is the pregnancy viable? Confirm the number of fetus at 13 weeks. There you can know the fetus are how many and how they are. This is where you confirm the accurate gestational age, and even you can detect if you have an ectopic pregnancy. But at 13 weeks, you will have known earlier that this one is not an ectopic pregnancy. You see, very important. And also to detect some things like molar pregnancy. We have just talked about molar pregnancy, and then we saw two types of molar pregnancies. And these molar pregnancies were, go and view the video and you will see them. The first one was an empty ova being fertilized by a sperm, and the second one was two sperms fertilizing a normal ova. You get a molar pregnancy. Narcocirculants, chromosomal screenings. These are things that we do to check out. This one we confirm that the baby here is okay. See, someone is really calling. A minute. Yes, guys, sorry, I was a bit. Sometimes you can come online and then you get some issues. So, my guys, sorry, I'm still here, Dr. Benjamin. Thanks you, Uncle, for being here. I was working on something here. So we are continuing. On. We were at the second trimester. And the second trimester is where now we have issues, because here is where we confirm several things. First trimester, the 13th. So let me say this first. When a woman, after the 3 months, the 11 weeks, there is where it's very important for you to confirm very specific things. It is very important to confirm, listen, the 11 week, confirm the pregnancy viability, number of fetus that you have, because you may be carrying twins and you don't know. You may be carrying a molar pregnancy and you don't know. So at the 11th week, it is very important to do an ultrasound. An ultrasound is an electronic device that is put on your belly, and it produces images by sound waves. So when we see we put you on an ultrasound, we confirm very important things. One is pregnancy viability. Number of fetus. Are you carrying twins or more than twins or just one fetus? Accurate gestational stage. This is where we confirm the accuracy of the gestation at 12 weeks, at 11 into 16 weeks. And here is where we detect molar pregnancy. This is the time that we detect the pregnancy that we were talking about. You remember we were talking about a very funny pregnancy, that you are positive in pregnancy, but you are not carrying a baby. Now this is the time that you consider. This is when time you consider checking if you are carrying a baby. It's very important. This is very important. Knuckle transience, those are chromosomal things. So the importance of week 11, 13 and plus 6 weeks is to confirm those things that I've said. Confirm pregnancy viability, number of fetus you are holding, accurate gestational stage, ectopic pregnancy if you are having, and molar pregnancies if you are having. Now let's get into screening of the several things that are there. Genetic screening. Screen for Down syndrome, trisomy 18 and trisomy 13. You know, Down syndrome. This is where it's important. Knuckle transience is called screening of this. Genetic issues. You know, cell-free fetal DNAs. We check them here. Cell-free fetal DNA. We talked about molar pregnancy. A sperm fertilizing an empty ovary, then something just starts to grow. You have chorionic mass instead of good villus that are attached to the placenta. This is where we talk about it. Now let's go to the second trimester, because we are talking about the baby from day of conception to the day of giving birth. Now we are working with this lady of ours, working with this lady of ours step by step. We are going step by step to the day of delivery. We are at the second trimester. Now we have started the second trimester. Happy is here. Happy, how is you? Hope you are doing good. Happy, which country are you from? Happy, tell me which country you are from. Let's interact. We are talking about pregnancy. Now, at every visit, second trimester usually visit occurs every 4 weeks. Every 4 weeks. So, you check on maternal assessment, weight gain, blood pressure, urine in protein, glucose in urine, or your systemic glucose. You see, those are things that you check out. Check out about your weight gain, blood pressure, check out about your urine in protein. And you know, urine in protein tells us about the kidney and kidney damage and organ damage. And urine glucose. Urine glucose may tell us that you're having something more than just diabetes. You see, do you have headaches? Are your feet swelling? Are you bleeding? Reduced fetal movement. Is the fetus having the movement late in pregnancy? Now, fetal assessment. Let's talk about fetal assessment. Fetal assessment. Check on the fundal height. Check on the fetal heart rate. how is your fetal heart rate going. Check fetal movements. Check on the fetal movement. These are very important things, my friends, when it comes to a minute. Today my network is playing that game, my friends, so don't worry yourself. My network is playing that game. Yeah? So growth assessment is very important. Now let's go to ultrasound, week 18 to 22. This is the second trimester. Let's talk about the ultrasound. Detailed anomaly scan. You see, it is week 18, week 22, so the fetus has formed. Check on the brain. Is it okay? You check on the heart. Is it fine? Check on the spine. Is the spine of the baby okay? The kidneys, are they forming the way that they are supposed to be forming? Check on the placenta position. Is it where, we have several ways a placenta can be placed a wrong place, and then it causes a mother to bleed continuously. Is the placenta attached or is it removed? Is it detaching? Sorry. That is called placenta abruption. Check on the amniotic fluid. Is the amniotic fluid enough? Or is it more? You can have enough amniotic fluid or you can have less amniotic fluid. Check on the congenital abnormalities. The congenital abnormalities entail several things like heart complications. You have seen something that is called tetralogy of Fallot. That one we talked about it some times ago. Tetralogy of Fallot. You check on the brain. Congenital abnormalities, even the brain is entailed. Is the baby forming normal according to the age of gestation? Is the baby forming normally according to the age of gestation? And now we go to a very important thing that we should check on, and this important thing is called laboratory tests. There is something that is called oral glucose tolerance test to check if you are okay and your body is managing glucose in the right way. Glucose challenge test, screening. Here you repeat hemoglobin. You repeat the hemoglobin to see if you are anemic or not. Check if you are anemic or not. It is very important sometimes to check on these things, my friends. Very important, because you may not check on the HB and it may affect you. It may affect you when it comes to high blood pressure. Sometimes people that are anemic, mostly they have either hypotension or hypertension. Then there is vaccination. Tetanus toxoid, according to the preferred schedule of your country. According to the preferred schedule of your country. There is tetanus toxoid and there is tetanus diphtheria. Influenza vaccine. You don't want to get a mother that is carrying a baby and flus are all over the mother. And tetanus can damage the baby and the mother also, because if you get tetanus vaccine, infection, when you are carrying a baby, what will happen? You will be having a serious disease, and the baby may be born with a neural tube development problem. The brain may may have complications. Pertussis vaccine, TDAP, were recommended. It's very important. Now let's go to third trimester. Visits become more frequent. Third trimester, here visits must be frequent, very frequent, every 2 weeks, because we are now expecting a baby from 28 to 36 weeks, or you should be near a person that is a doctor. Weekly after 36 weeks, check on a doctor every time. Check on a doctor every time. Check on maternal assessment. Every visit, check on blood pressure, weight gain, edema, urine in protein, urine in glucose. Very important, because as the baby becomes bigger, demands rises. And when demands rises, what happens? When demands rises, problems begin. Because if the mother is not able to give the demands, the problems are there. The screen for preeclampsia, I usually talk about it. Gestational hypertension. Gestational hypertension. Hypertension that has come because you are pregnant. Check on diabetes complications. Diabetes complications, end organ damages, neuropathies, confusions, diabetic ketoacidosis, all those. You see? Now, as you check on these things on the mother, we have to check on the baby. What are we checking on the baby? The baby, we are checking on the fetal assessment. Check on the fundal height. Is it according to time or period or weeks? You may have a very big fundal height and the baby is not yet that gestation. Is it according to gestational age? The fundal height is the womb, how big it is and where it has risen. Fetal growth, fetal heart rate, presentation. Presentation means how the baby is. Is he on a bridge or a head? Check on the cephalic. Is the baby okay? Cephalic is the normal way. Bridge presentation. People say that bridge presentation means the baby is sitting. The baby is sitting in the womb. Engagement, engagement, and fetal movement. The baby having the normal fetal movement. Ultrasounds, growth, placenta, amniotic fluid. When you do an ultrasound at this stage, this is very important for mothers. It's very important for mothers. An ultrasound at this stage checks on growth. Is the placenta sufficient? Amniotic fluid. Is the amniotic fluid that is holding the baby sufficient? Check on Doppler's ultrasound, high risk in pregnancies, and fetal position. Now, usually repeat hemoglobin. These are laboratory tests. HIV, syphilis. Repeat recommended. Because as you are here in this state, you continue carrying a baby, and you continue having this baby while making love. Because so you may repeat hemoglobin, HIV, and syphilis. Now we are just near to get the baby to deliver. Depending on local guidelines of where you are, you check on group B streptococcus. Group B streptococcus. Repeat urine testing if indicated. Streptococcus is a very bad bacteria, and it may give you very bad outcomes. Very bad outcomes. You remember, Streptococcus pyogenes is the one which is responsible for rheumatism and rheumatic heart disease. So if you are a woman and the process of giving birth entails so many things, traumatic events, instrumentations, and you check on this, group B streptococcus, you can give a prophylaxis of an antibiotic to make it get away. You don't want to have women giving birth with infections from group B streptococcus. Fetal well-being. How is the fetus well-being? There is something that is called non-stress test. Measure fetal heart rate in response to movement. It is called, we check on the fetus heart rate, how the baby in the womb, the heart rate is going. And then we check on the fetal movement. see. And then there is something we had talked about previously, and this thing is called biophysical profile. Biophysical profile is very important, and it entails biophysical profile. These ones are things that we check in the baby's womb while using machines. You see, while using machines, because you cannot access the baby if you don't have important machines like ultrasound machine. So biophysical profile of the baby assesses fetal breathing movements, gross body movements, fetal muscle tone, and amniotic fluid volume, and non-stress test. And non-stress test, we have said it is measure fetal heart rate response to movement. But each parameter here scores 0 or 2 points for maximum score of 10 points. So the mothers that will watch or are watching this video, now you start to understand what was being done. Now, evaluate blood flow in the umbilical artery, fetal brain, and other vessels, especially in fetal growth restriction. You see, you are using a machine that is called a Doppler ultrasound, and it is checking the blood flow. Because Doppler means ultrasound, the normal ultrasound does not show how the blood flows in veins. But Doppler's blood flow will show you how the blood flows in the veins, in the umbilical artery vein, fetal brain, and other vessels, especially in a fetus that has a problem with restriction. Doppler's ultrasound is very important. It may detect several things in a fetus that is still in the mother's womb. Complications. Screening for pregnancy complications. This is very important for pregnant women. So if you are watching, Hilda Taylor, Dr. Benjamin, blessings to you and everyone in the chat. Have a blessed day. Thank you, Hilda Taylor. Today I'm talking to our women that are at the stages of giving us life to this world. Now, throughout pregnancy, healthcare providers monitor several things that are very important. Hemoglobin for anemia, blood pressure for hypertension. Blood pressure, when you check it, blood pressure, and you relate to proteins in urine, what does it confirm? Preeclampsia. Eclampsia is when your blood pressure is high and you are convulsing, you are having seizures. So pre means before seizures. So if you check and you see blood pressure is high and urine is in proteins are in urine, if you don't take care faster, what will happen? What will happen is this woman will start having eclampsia. You'll have seizures. So you have to go to the hospital and be given medication. Urinalysis and culture, urinary tract infection. Blood test for HIV, blood test for syphilis, blood test for hepatitis B, blood grouping antibody screening for rhesus incompatibility, very important. Anatomy scan for congenital abnormalities. And then I will end today with nutritional studies, but tomorrow we are continuing with this topic, which is very important. Nutritional studies. Let's talk about eat a balanced diet when it comes to nutrition. Eat a balanced diet rich in iron, protein, calcium, and folate. Take prescribed supplement. Trey Marie, hi Trey Marie. I've seen you're here. Big up. Today I'm talking to the mothers. Just slowly by slowly. Today has been an easy day for me. It has been an easy day for me. I've gone out in the morning. Today I'm at work and it's not so busy, so I feel just relaxed. And I decided let me talk to our women about taking care of pregnancy. Eat a balanced diet rich in iron, protein, calcium, and folate. Take prescribed supplements, folic acid, iron, calcium recommended. Stay physically active. pregnancy approach and give yourself an appropriate exercise. Maintain good rehydration and adequate rest. Very important. Sleep on the left side in the late pregnancy to improve blood flow. Don't sleep in the right. You may be pressing some blood vessels. Sleep in the left to improve blood flow. Prepare a birth plan and identify a healthy facility for delivery. Recognize and seek urgent care for danger signs. Big up everyone who is watching. Thanks for everyone who is coming around. But there are some things that are risk danger signs requiring immediate medical attention. Vaginal bleeding, severe abdominal bleeding, severe headache. Sometimes you may have a very severe headache while you are pregnant. And you see, severe headache can bring what? Severe headache can bring hypertension, and hypertension can damage the baby's health. So these are important things that we're talking about. Danger signs. Please like and subscribe the live. Thanks, Trey Marie. Trey Marie, welcome to the chat. Today I'm talking just taking care of our ladies. Taking care of our ladies. Severe headache. Sometimes you wake up in the morning and you have blurred vision or visual disturbances. You should go to the hospital. Swelling of the face and hands and even the feet, and you are a pregnant woman. Be it if the first trimester is the second trimester or the third trimester, because sometimes people lie to themselves that, as the pregnancy grows, it will go away. There are very many complications that entail you having the problem of swelling of the hands, feet, and face. So let the doctor decide what is the problem. Don't say because your mother, your uncle, your auntie had the same problem, it will go away. No, let the doctor decide. Persistent vomiting, and in pregnancy we call hyperemesis gravidarum. The more you vomit, the more you are losing electrolytes. And losing electrolytes, you know what happens. The kidney suffers and you become dehydrated and you have problems. Fever and chills means infection. Fever and chills means infection. You see? Just a minute, guys, I come. Fever and chills means infection. So I'm back, my friends. I am back. I am back here. I am back here, my friends. So let's continue. Let's continue about the danger signs as we're about to end. So if you are here and you have a question, just post it. Post it. and we discuss it. So we say when you have fever and chills, you have an infection. Leakage of fluids from vagina. Fluids are blood and some other fluids that you don't understand which color is this. Go to the, if it's yellow, if it is red, if it is brownish, if it is green, go to the doctor and tell the doctor that I have this fluid that is coming out and I don't understand what type of fluid is this. Sometimes you may be pregnant and then you have convulsions. Pregnancy and convulsions. Go to the doctor. Seek doctor's advice. Seek doctor's advice. Difficulty in breathing or chest pain. Go check to the doctor. So today we have gone through these things, and we have said that before conception you check your health assessment, vaccination, take your folic acid, and chronic disease optimization. Chronic disease optimization means if you are diabetic, make your sugar levels normal. Plan to see a doctor so that your sugar levels could be stabilized. If you have high BPs, make your sugar, your pressures to be stabilized. Very important. So we go to the first trimester. Pregnancy confirmation, first trimester. Dating ultrasound to check the date, and blood tests, HIV, VDRL for venereal diseases, blood sugars, very important. Those are called infection screening and vital screening. Weight is very important. Second trimester, blood pressure, weight, fundal height, anomaly scan. That is second trimester, 14th week to 27th week. You check the fetus if it's okay. That scan is called normal anomaly scan. Repeat hemoglobin levels, very important. Repeat the hemoglobin levels, because as the baby grows, demands become more. So check the hemoglobin levels. Third trimester is very important. Frequent blood checks, everything, fetal growth presentation. You are given some assessments. Dr. Benjamin, what causes blood in the urine? Blood in the urine can be two-way. Blood in urine can be two-way. From the kidney to the bladder, or from the uterus to the vagina to the bladder. So if you are not having menses, or you are not having issues like fibroids, what do you expect? It is coming from the kidney to the bladder to the vagina, then you see blood. Nephritic syndrome, nephrotic syndrome. They are called those things: nephritic syndrome, nephrotic syndrome. And there are two ways that you can say that I have blood in urine. There is gross hematuria and there is microscopic hematuria. Blood is visible, making the urine pink or red or Coca-Cola colored. But the microscopic blood is only detectable in urine under microscope or deep stick testing. You see, under urinalysis. So there are several things that can make you have blood. Urinary tract infection, UTI, can make you have blood in urine. And this one comes with pain or burning during urination. Frequent urination, urgency. You feel like I want to urinate every time. Lower abdominal pain, cloudy or foul-smelling urine, and sometimes you feel fevers. If you have the nephritic syndrome or the kidney is having an infection, you will feel the fevers and you will feel having blood in. You will see urine in blood. Bacteria inflame the urinary tract lining, causing bleeding. These are infections. UTI. Okay, there are some people that have kidney stones or ureteric stones. The stones can scratch the urinary tract lining. You see, the stones can, and then you feel flank pain radiating to the groin. But when you have kidney stones and ureteric stones, there are some symptoms that come with them, which are blood in urine, painful urination, nausea and vomiting. See, the coffee cakes, hi. Coffee Cakes is laughing at me. How is you, Coffee Cakes? No, sometimes when some people call and my phone is on, it mutes. So I don't worry. I'm sure right now you can hear me. So I'm still answering Hilda Taylor about blood in urine. So flank pains, radiations, I'm okay, catching up on the rest. Been chasing sleep. Oh, nice. No worries. Coffee Cakes, you've got, and today, Coffee Cakes, I'm cool. Today in the morning, I had an morning off. So I decided to take my friend, my second born, and we went to take breakfast away from home. And I returned him home, and then afternoon I came to work. I'm doing good. Hope you are too. And that's nice. We thank God. So you can check the video. We went live. We took breakfast. There is a video that is there just before this one with my little friends. Yummy, what did you eat? The normal breakfast. Some tea. He likes sausages and some. And then we went back home. He loves those. So we took tea and some snacks, just normal snacks, and we went around, we drove around, and then I took him back home. So we were talking about pregnancy, and I was answering Hilda Taylor about blood in urine. She had asked Dr. Benjamin what causes blood in urine, and now I'm just answering Hilda Taylor about blood in urine. Infections, kidney stones, and stones damage the blood vessels. Bladder stones. Stones are not good things. Common in patients with urinary obstruction. And when you have stones, besides blood alone, you will feel pain in urination, low abdominal pain, and blood in urine, of course. Kidney infections can cause it is called pyelonephritis. Fever and chills, flank pain, nausea, burning sensation. You'll see urine with blood. Trauma, injury to the kidney, bladder, or urethra can make you have blood in urine. But in men, prostate problem, prostate swelling can cause you to have blood in urine. Prostate infection, this is in men now. Kidney diseases, cancers, even in women, cancers can make you have inherited disorders like sickle cell, bleeding disorders, polycystic kidney diseases. You see, there are so many. Renal papillary necrosis and menstruation contamination. So when you have blood in urine, it is very important to check on your doctor. Check on your doctor. Talk to your doctor. Let your doctor decide what is the problem and why are you having blood in urine. Don't generalize. Hope, Hilda Taylor, you've heard that and I've answered your question in a correct way. Any other person who has a question, please You are welcome. Bring the question. I'm welcoming anyone with a question. So, the third trimester we have talked about preparing to give birth, checking the pregnancy, bringing the pregnancy where it is supposed to end. We will talk about the next video. We will talk about preparation of pregnancy, delivery, and after delivery, because we have started from conception, we have gone through, and now our baby is just about to be delivered. But there is a very important thing that I want us to talk about, that is called rhesus isoimmunization, because some people asked me, Doc, why do some mothers get injections? They go to have a specific injection at specific dates before they give birth. You know, the injections that mothers are used to is tetanus toxoid, and if there is any infection, you are given some tablets, and folic acid and iron. Those are things that our ladies are. But when they see an added thing, like I hear and understand, Dr. Ben. Thank you, Hilda Taylor. Double tap the screen and please don't forget to subscribe to the channel. Blessings are the coffee cakes. But I was saying, when they hear another injection at 28 weeks and then after delivery, like confused. Listen, if you are a rhesus factor, you know blood grouping. When you do a blood group, people say I am O positive, I am O negative, I'm AB positive, I'm O, you know, those O negative, O positive. So when you say O, your blood group is O. Rhesus factor, what is I want to explain that thing before that video comes. Johnny Be Good, greetings everyone. Greetings, watching and liking the video. What do you understand by I'm B positive? Oh, Leila, you're B positive. Okay, nice one. There is something that is called rhesus. What is rhesus? Let's understand. What is rhesus factor? Because you see, Leila Ali says she's B positive. Rhesus factor is an inherited protein. It's called a protein, antigen. Yes, Johnny Be Good. I was talking about it at Barry walking exercise. We just lost Fantan Moja, man. Fantan Moja sang Rasta God Soul. And we let me get away from this first a bit, just a bit. Morgan family lost Peter Morgan due to heart diseases, heart attack. Now today we have lost Fantan Moja out of heart attack. Why is heart attack following our reggae artist? Why? I have to find out why. Or is it the people that have high emotions dying with heart attack? May the soul of Fantan Moja be preserved in peace, wherever it is. He was a good musician. You remember Peter Morgan? Then now we are at Fantan Moja. It's very sad, very sad. So let's continue and say and talk about what is rhesus factor. It's an inherited protein found on the red blood cell. It is one of the important blood group system of the ABO compatibility. If your red blood cell do not have rhesus protein, you are rhesus negative. So let me say I don't have a paper to check. On your red blood cell, that protein is inherited from previous person. Like I've drawn, wait, let me draw. Like this red blood cell. Let me. This one, my son was drawing some cartoons. Let me use another. This one. If you have any question, let's talk about it. I want to people to understand what a rhesus factor is. What a rhesus factor is. So this is a red blood cell. If you have any question today, just ask my friends. My friends, just ask. Just ask the question so that I can. My topic has ended, but I'm just continuing with the question that have been asked, and I'm explaining something. So look at this. This is the protein in blue. This is blood group. Let's say this is the red blood cell. So this is A positive because it has the protein in it. This is A negative because it doesn't have the protein in it. You see, it doesn't have the protein in it. So it is inherited from, this protein is inherited from your parent. So let's pick a parent who is having A positive. Gets a father who has B negative. A parent who has A positive, a mother, falls in love with a father who is having B positive, B negative. So if this one sleeps with this one and they have a baby, you know, the A positive may go, a child, a fetus, may inherit the father's blood group, which is B negative. The child may inherit this. So the child in the womb will be B negative. And you see, this is A positive. So the blood of the mother accidentally can cross to the womb of the baby. And the A positive and B negative will interact and they'll start fighting, and the baby may have problems. That is why we give anti-D. It is called anti-D. To sensitize this, not to fight this in the baby's womb. That is why it's called rhesus isoimmunization. Anti-D. Are you positive or negative? So, anti-D means if you are positive, the D factor shows that you are positive. So we give that injection to stop the protein from reacting to the baby. We will talk about rhesus isoimmunization after we finish these pregnancy journeys. Our mothers who are pregnant are on the journey of delivering babies. Always, if you are a new mother, always check. If you are a new mother, always consider asking your partner, what rhesus factor are you? If you have a partner and always you are having miscarriages, if you have a partner and always you are having miscarriages, consider getting the blood group of your partner. Consider getting the blood group of your partner. It may be you are having a problem with rhesus isoimmunization every time. You may be having problems with this anti-D, A positive, the rhesus factor, and it's the one which is destroying your babies every time. I know you have had some people, I know here there are some people that you have had every time this person conceives, a lady, every time the person conceives, the person gets a miscarriage. These are things that entail in this phenomenon. So you can advise that person that you know, in the villages people say that that person has been bewitched. Very important to advise that person that you have not been bewitched. It is rhesus isoimmunization. You see? And we don't believe in bewitchment when it comes to medicine. So that is how people get miscarriages, and you never know. And then a woman is told you have a problem, go to your home. We don't want people that are always giving us miscarriages in our compound. So anyone with any question, as this is the third day that we have lost our reggae legend, Fantan Moja. Let me get one song that Fantan Moja sang. Let me get one for his honor, man, for his honor. Fantan Moja is a Jamaican reggae artist. Fantan Moja. It's sad, man. It's sad losing legends. When Peter Morgan died, I really felt bad. I really felt bad. So this is another death that is making me feel today, why do we lose big people and good people like him? Listen, some songs that Fantan Moja sang. Listen.
The vision for me to fall, gonna make me stronger.
One of the songs that Fantan Moja sang is Stronger, man. We give thanks and praise. Those were the songs. A legend sang. Just imagine. A big tunes that this guy gave. Yeah, Dayla. If you have ever known Fantan Moja, man, Fantan Moja was a great artist, and for this life, I'm giving his honor and tribute to him. God can bless you. Fantan Moja, where you are, please rest in peace. We loved you so much. Listen to those big tunes. Fantan Moja. Only your love is the blessings to this world. And you know, his soul and his world will reign forever.
Bless me through my days.
Johnny Be Good, I know you remember that tune so well.
We tell Dr. Speaks and girls and everything will come after. Don't get.
I listen to that sweet voice and song, The Fallen Soldiers. This is for our fallen soldiers. We miss you now. This is for the fallen hero, Fantan Moja. Big up tune it was. I listened to all his music, man, and these musics were big tunes. Sometimes when you see this season of like this, you feel so, you get to seasons like this ones, you feel so bad, man.
Hello, this is Mike.
He gave us a tune, a big tune that was called Rasta God Soul. Listen to this tune, Listen.
Warrior
Listen.
Rasta God Soul. Reggae music rocking my bone. My bone is never getting old.
We we thank God for giving us good people from Jamaica, good sounds from Jamaica, good voices from Jamaica. But when God takes them away, we feel so sad. But we don't know. You can't challenge God. God is everything, and He has a reason for everything. I'm here cooking peas and baked salmon with rice in pumpkin. So these are the things that we have. I woke up in this message, and Fantan Moja died because of a heart attack. And I'm kind of like confused because all the big tunes, people that bring big tunes like Peter Morgan, Fantan Moja, all of them, it's heart attack. People that are perfectionists and heart diseases are killing them. So everyone who's been in the channel, everyone who's been watching, we thank you for watching. We thank you for coming through. Unless anyone has any question, anyone who has any question, you are invited. Let me give like 2 minutes before you give me anything, any question. Before I leave, Jakiwa sang Before I Leave. Anyone with any question, big up to you, Jamaican uncle. Big up to you, our new friend Sibel Yusuf. Uncle, be careful, mind over work. Jamaican uncle here, always careful, and blessings to you. Sure, blessings to you always. And we can see here we have a happy person that came around. Hilda Taylor, Coffee Cakes, everyone who has been watching, Layla, and Johnny Be Good as you're there in the kitchen. Big up every time. Today we will be listening to Fantan Moja's songs all through. The Fallen Soldier, the Fallen Voice, and we respect and we say, we know why you took him from us, because we are just human. You all know everything. So anyone with any question, I can see there is no one with any question. I have 1 minute to go to give anyone who has any question before I leave. So all the support and thanks to everyone who has tuned into this platform. Today has been a sad day losing Fantan Moja. When I heard that news, I felt bad because, he said, Rasta got soul. And, we give thanks and praise. And one of his music is called Give Thanks and Praise, and we say all is good. There is one president in Kenya that said, when time comes, you have to say, all is well. All is well. It is well with my soul, And we say thanks. Let the spirit and the voice of Fantan Moja be prevailing, and may he rest in peace. So my guys, kudos for being here. Bye bye. See you to the next show. Big up every time.